Hi, this is Dr. Randy Hurst. I'm doing various videos, as you may have seen. Haven't done them in a while, so trying to do a little catching up. I decided to do this one on the difference between addiction and dependence, physiological dependence. But I'm going to tie it, I'm going to do an overview now, and then I'm going to tie it into what I'm beginning to see as addictions that we don't think about. Because there's always the ones that everybody thinks about. Addictions to alcohol, nicotine, opiates, cocaine, speed. All of the street drugs and then the kind of legal drugs that we hear a lot, see a lot of. In this case, making the distinction about what the American Psychiatric Association, American Psychological Association talk about in terms of use disorders, which used to be called abuse, and then dependence, which now is just an extreme part of the use disorder, versus what typically is referred to as addiction. And the dependence, or more severe use disorder, is where people go from enjoying a feeling that comes from a drug, or maybe an activity, like say shopping, or computer screen time, gaming, to where there's this positive draw, this feeling good. It can be feeling calm, energetic, powerful, with some of the speed drugs, energetic and powerful, stimulated, kind of almost orgasmic with things like the opiates, to pain relief and otherworldly feelings, almost the seductive feelings of some of the drugs like the ecstasy, MDMA, what referred to as date rape drugs, but also people will do that for their own feeling of high. I don't want to glamorize these, but any drug that's used is used for what feels like a good feeling. And, that's kind of the good side. That's what people will use for. But in time, it takes more to feel that same feeling. In fact, through the years, especially working in drug treatment, when I was hearing this a lot, the people would say that the early experiences, sometimes just the first experience, was so amazing that they just were trying to find that again, and often didn't. They'd use more to get that feeling. They'd mix with other drugs to get that feeling. They would, that's mainly it. Use more or use with other drugs. But the feeling would be harder to get. Or they would get it again with some new mixture or some new dose, and then it wouldn't last long. It would take more. Some drugs take a tremendous amount more, and others not so much. There's this weird thing between what's called the therapeutic dose, or the dose that people are going for, and the lethal dose. And the dose that people are going for can go up quite a bit, high tolerance, but the lethal dose in many drugs doesn't change much. So you're getting closer and closer and closer to what can be a bad outcome, so to speak. And, we've seen this a lot recently with well-known people who end up overdosing. They often are using close to what they had used before, and either a change in the concentration or the purity, or they're just really getting close to that lethal dose and go over the edge. This happens a lot with opiates. That's why now there's this push to have people have Narcan available, so that if they find somebody, a friend or whatever, family member that's overdosed, they can give them this antagonist, this thing that reverses the effect right away, which is really a lot of conflicted feelings about that. It's really important to save somebody and hopefully have them see the crisis that led them to the overdose. But there are people who will feel like, oh, I can get out of it now. I just have to have somebody around me that can catch it. I can get as close to the edge as I need to have the feeling I want. Okay, the trouble with this is that in time, when they don't use, they feel bad. And the bad is the withdrawal. People who use drugs that are central nervous system depressants that calm them down, that feel good in a calming, in a pleasant way, that they may be more active in terms of socialness, but it's because they're just settled into a place that they feel good with. The after effect is agitating. Their blood pressure goes up, their heart rate goes up. They may end up with diarrhea in some cases, or have real over-energized bodies that don't feel right. They can't sleep. That's the opposite, or the rebound effect. And when people use stimulants, the speeds, the cocaines, the things that speed the body up, the rebound is the opposite. They crash. They feel depressed. They feel tired. They just sleep. Sometimes with speed, they can sleep for days at a time. That need to use again in order to feel normal, to use again to try to feel good again. But of course, with the high tolerance, it's harder to feel good again. So a person kind of keeps chasing that. That's dependence. The part of it where not using feels real bad. Now there's a weird little distinction about what is addiction then. Dependence is about withdrawal. And there's a lot of people who say have surgery and they're given an opiate to deal with pain of the surgery and the healing and the cutting of tissues, muscles and stuff like that while everything is healing. The swelling that comes from it results in a lot of pain. And so in order to get through that pain that helps the body relax, that helps the healing happen faster, doctors will give opiates, and some of those people will develop a dependence. But when the doctor cuts them off, they don't press the issue to get more. They recognize, and the doctors maybe even explain, that there's this rebound, there's this withdrawal that will happen for a few days, and they'll get better. And the pain will increase, but they'll get better because the healing is basically done. And there's patients who will accept that, go through what's kind of a lousy, flu-ish kind of period, and they won't feel the compulsion to try to find the drug again. The compulsion to find the drug again, to find that feeling again, despite knowing that there can be bad consequences of the addiction, of going through the withdrawal again. But the need to use again, that's the addiction. So some people who take pain meds will get addicted. They will drug seek. And one of my brothers who has passed away, he was a recovering alcoholic, and he had shoulder surgery, and he needed that pain medication. He explained to the doctor how painful it was, and the doctor extended him a bit, but then said he's got to cut him off. Well, my brother convinced him that no, it's really bad. And I said to him, I said, look, you're doing what addicts do. It's so important. He says, but the pain is so much worse. And I said, yeah, that's the rebound. Live with it for 4 or 5 days, maybe a week or so, and it'll get better. If the doctor is convinced, and if it gets worse, then tell the doctor a week from now of not using. And, and the doctor will look to see if there's any objective reasons why it's not better. But otherwise, the doctor's going to see you as drug seeking because what? You're drug seeking. And, you believe it's because the pain. Well, it is the pain, but it really is just the rebound and that desire, that push for relief, despite what it's doing in your relationship with other people or how it might be affecting you at work or all of those things. Mainly, think of addiction as continuing to use to feel normal, continuing to use despite bad outcomes, bad consequences. And where there's no need, there's a felt need, but not an objective need. Dependence is where when you don't use, you don't feel normal, and you have withdrawal, and you're trying to stave off withdrawal. Okay, I'm going to tie this in the next video we've tied it into drugs. Next video, I'm going to tie it into something that's a little different. So, check it out. Well, I'll tell you. How about the addiction to avoidance? So look for that video.